Today I'm gonna be filming a get ready with me for work. Alrighty, hello everybody. So today is my first day going to the floor, so I'm super excited. So I'm currently running a little bit late, so I'm gonna have to quickly do this. I have 20 minutes to do my makeup, which is enough time, but I just prefer to take my time doing it. But I'm not gonna be able to do it that way. Yeah, so yeah, let's get into it. So yeah, like I said, today's my first day on the floor. I'm gonna be working on a med-surg floor. So basically, on a med-surg floor, you kind of get a little bit of everything. We can have people who are in there for the common cold, or I have had patients who had a gunshot wound. So it's a wide variety. I think that's why I really like med-surg, because you just get a little bit of everything. So also, just to kind of give you some background, I worked as a PCI, which is a patient care intern, and basically what that means is that the hospital has student positions. So basically you can be a PCT, which is a patient care technician, or a nursing assistant. Different hospitals call it different things. Unlicensed assistant personnel, that's what the NCLEX calls it. But depending on the hospital, it's called different things. And my hospital had positions where you could work as a nursing assistant or a tech. We could work as that as a student. It was a really great position because, at least on my floor, I was really able to set my own hours. They understood that you were a student in nursing school, and that's stressful, and depending on the week you can work more hours, and if school is a little bit slow, and then on the weeks where you had finals and stuff, they understood okay, she's not going to be able to come in here as much. So I really like that. And then also another great thing about working as the intern was that you could, if they had enough techs on the floor for that night, I got to follow a nurse. So it was kind of like clinicals, but without all the annoying paperwork that comes with clinicals. The floor that I'll be working on as a nurse is the same floor that I worked as a PCI. I'm familiar with the nurses. I'm familiar with where things are. Just I feel a lot of adjusting to being a new nurse. Part of that is that having to figure out where things are, having to figure out the codes to get into the different rooms on the floor, trying to figure out what nurses you can really go to if you need help from something. I already know all of that, so I feel confident in that area. But that being said, I'm kind of worried about delegation. I guess a fear of mine is or not a fear, but maybe something that I'm concerned about would be delegation, delegating tasks to other people. I don't know, I'm just worried because they've seen me in a certain role, and so now I'm transitioning into a different role. How is that going to be perceived? But I think it should be fine. But yeah, I would be lying if I said I wasn't nervous about that. Just a little bit. So even though I'm running a little bit late, I can leave the house a little bit later than I normally do, just because the quarantine that's going around all over the country. And basically there's nobody on the road. So usually way to work, I have to leave because I live a good 20-25 minutes away from work. with like no traffic, it's a little bit less, so that's nice. So orientation lasts, I think, 8 weeks on my floor. There will be plenty enough time to get acclimated, because again, I did my practicum. I didn't do my practicum at this hospital. I did it at another hospital in the area, but it was a med surg floor. So I feel like I have a lot of experience on a med surg floor, but all the nurses in my life have told me, like, be warned, it's gonna definitely be different. Things are different when you're a nursing student versus a PCI versus someone who's training with a preceptor versus when you're on your own. So like, this is the next phase of like just becoming more comfortable in my nursing abilities. But like I said, because I worked on this floor, I like already know what nurses that I can like really go to and ask for help. But I will say, like, I think as a whole, the floor that I'm going to is like a really good floor. Like, most of the nurses I feel like on my floor would be more than willing to help me, so that's good. As far as COVID is concerned, I don't know, I'm a little nervous about that, but just because I've heard like reading online and stuff of other hospitals like running out of PPE and things like that, and that's scary. I feel like at this point most hospitals probably have at least one case of COVID. Also, I've been like reading online that like younger people, like people in their 20s and even younger, have been diagnosed with this, and there's been an increasing amount of cases found among healthcare workers. So that is alarming, but I'm not gonna try not to focus on that. Honestly don't know how people do get ready with me, because I feel like I'm really not doing a great job. Like talking and trying to get everything done. Also, I'm running late, so that's part of the problem too. As far as like my long-term nursing goals, I am still like undecided / confused. I like really have an interest in public health, and public health is such a broad field. I'm still trying to figure it out, basically, is what I'm trying to tell you all. Like, I don't know. I've been trying to find some places that I can volunteer at. I guess what draws me to public health is like the prevention aspect of healthcare, like preventing chronic diseases and helping people manage chronic disease. I like patient education. I like my dream job, I guess, in public health would be somewhere where I or a team of people would like identify a problem in like a community. So maybe people are having a hard time managing their diabetes or something like that, and then developing a program based off of the needs of that community to help address that issue. So like developing, implementing a program that would help address that issue, and then tracking to see how effective it was and making changes based on that data.
Some of the old songs. For old time's sake. As time goes by. It's been a long time. For old time. For old time's sake. As time goes by.
Congratulations, girl. All right.
Thank you.
You're welcome.
Chloe, give me